This photo story has been prepared to teach the proper technique for the injection of insulin. The first part of the demonstration will be for those who use vials of insulin. The second part will cover insulin that comes in pen devices. Injection technique for both will be demonstrated at the end of this presentation.
Before preparing your insulin dose, thoroughly wash your hands using soap and water. This should be done no matter what type of insulin product you have. Prior to withdrawing the insulin, inspect your vial. Be sure to check the expiration date as well as for any signs of insulin breakdown within the vial, such as long streaks or clumps. If the vial is expired or the insulin's appearance looks different than it did when you first acquired the product, do not use it. Obtain a new vial as soon as possible. Once your insulin has been inspected, if you have a cloudy type of insulin, gently mix it by rolling it back and forth between your hands. Do not shake the insulin. If your insulin is clear, you do not need to do this. If using a new bottle of insulin, remove the colored, flat plastic cap that is on the top of the vial. The rubber stopper should now be visible on the top of the vial. Clean the rubber stopper on top of the insulin vial using an alcohol pad. You should do this each time you use the insulin. The insulin vial is now ready for use. Safely remove the cover of the needle on the syringe. Take care not to let the needle touch any surface other than the vial of insulin or your skin where you will inject the insulin. Pull the plunger on the syringe back to the number corresponding to the desired units of the insulin to be given. For instance, if you are to inject 10 units of insulin, you would draw the plunger back so the end of the plunger is at the line corresponding to 10 units. Make sure that you are using a syringe specifically meant for insulin injection. Gently push the tip of the needle through the rubber stopper and push the air in the syringe into the vial of insulin by pushing down on the plunger. With the needle tip still in the vial of insulin, turn the insulin bottle and syringe upside down, holding the vial of insulin with one hand and the syringe in the other. This takes practice, but soon you will be able to manipulate the syringe and vial with little difficulty. Pull back on the plunger to get the desired dose of insulin to be given. The end of the plunger should be at the same mark as it was when you drew in the air. If air bubbles appear in the syringe after you pull up the insulin, gently flick the syringe with your finger to make the bubbles rise to the top of the syringe, and push the insulin back into the vial. Draw back on the plunger a second time to get the desired dose. Very tiny bubbles are not a concern. Pull the syringe out of the insulin vial and double check the dose withdrawn. Make sure that there are no large air bubbles present within the syringe, and that the tip of the plunger is at the desired line for the correct dose of insulin needed. In addition to vials, you may receive your insulin in the form of a pen. Many types of insulin come in this type of administrative device. There are some differences among them, but they all basically work in the same manner. Pull the pen cap to remove it. Be sure to check your insulin for type and expiration date. Use an alcohol swab to wipe the rubber seal on the end of the cartridge holder. As with the insulin vials, some insulin available in